Well, the governor says the state has now ordered 2,400 coronavirus tests. Those tests are said to be vital in helping control the spread of the virus. But as it turns out, being tested, not so simple. CBS 12's Jay O'Brien shows us the hurdles you need to first clear.
Jim, the federal government has said anyone who wants a test will get one. But you don't have to look further than our own newsroom to see that that's sometimes easier said than done. As defenses to COVID-19 spring up, the biggest precaution is still testing for the virus to make sure those who are showing symptoms aren't putting others at risk. Easier said than done. Look no further than CBS 12 Chief Meteorologist Erin Christensen.
If I should be tested.
She just came back from a trip not to a virus hotspot, but does have a slight cough. Erin spent hours today on the phone, starting with the Florida coronavirus hotline, searching for a test. They told her the only way to be tested is through her primary care doctor.
I haven't gotten anyone at my general practitioner's office.
Calling back, the health department then told her to call the CDC, who kept Erin on hold for an hour. We hoped for better luck and waited. You were worried about leaving your house before you got answers. You would still have to wait on the phone with the CDC
are still assisting
and the Florida Department of Health.
Please remain on the line.
We never got through, but fed up, we called a county health media representative. Excellent. Thank you very much. Officials we spoke with in the county said call the county health line and ask for the epidemiology number. They will evaluate you and tell you whether or not you need to go to your primary care doctor for a visit. That doctor will then write you a prescription if they think it's necessary to go to a hospital or a test site. Those are the places in Florida where you can get the coronavirus test. Dr. Sasha Johnson, a primary care physician, tells us doctors are screening for main symptoms like fever, cough, and fatigue.
The calls are coming in. They're pouring in.
Back to Erin, dodging the hotlines, she finally got through to a local ER who told her they would screen her before she came in.
I'd be more than happy to just go get tested right now.
On the Erin front, Jim, we do know that she doesn't have a fever. She traveled, as we said in the story, to an area that is not a hot spot for the virus. She went to Aruba. And now we also know that she currently is in the hospital being tested for the flu. Here's the last thing we wanted to tell you. We wanted to make you known as well. The thing about Erin is that she wanted to be tested because she didn't want to get anyone sick out of an abundance of precaution. It's not believed that she has the coronavirus. But the thing we thought about this, Jim, was that if she came back from a country like Italy that has so much of the virus, what would it be like if she came from there?
Does the procedures, do you think they need to be streamlined, or is this just, are we running into maybe some obstacles because this is happening so quickly?
Yeah, I mean, across the country, there are different forms for different testing, right? In Colorado, they've got places like drive-up test centers. In other parts of the country, their testing is different in a different precautionary system. This is just Florida's plan for now. If you see an increase in cases, it is presumed you'll see an increase in their ability to test.
All right, R.J. O'Brien doing some research for us. By the way, all the numbers that were referenced in Jay's story about coronavirus testing, they are on our website right now. The story is posted at our homepage. All you need to do is head to CBS12.com. This